You're listening to Beyond the Visible, the podcast that challenges the current focus on just what can be seen. Here we dig deeper into the therapies, the strategies, and the mindset shifts that create quality of life for people living with Parkinson's and other neurological diseases. I'm your host, Michelle Hill, medical SLP advocate, and your guide as we disrupt old narratives and build a stronger, more holistic approach forward. The views and opinions expressed by myself and the guests on my podcast are their own and do not necessarily reflect the positions or policies of any organizations they are or have ever been associated with. Also, this podcast is for education purposes only and is not to be considered medical advice. Now, on today's episode, I have the wonderful Darcy Pernoud from Back to Independence Rehab. Darcy is a doctorate of occupational therapy. She owns Back to Independence Rehab, which is located in Charlotte, and she is a Parkinson's expert. And we talk about all sorts of things, how OT and speech collide and benefit our clients. We talk about PWR and the specialty certifications and why you want a specialist on your side when you have a neurological disease. We also talk a little bit about insurance and how we first became friends, and it's a super fun episode. So, without further ado, let's go into Beyond the Visible. Hello, and welcome to today's episode of Beyond the Visible. Today, I am joined by my good friend, dare I say, good friend, Darcy, who is the owner of Back to Independence Rehab. Darcy, before we get into it, please tell us about yourself.
Sure. Good morning, Michelle. So I'm an occupational therapist. I've been practicing for 20 years. I've done all of that in neuro rehab. My roots for early days as a clinician were in spinal cord, brain injury, stroke. I've gone through the continuum of care from inpatient, day program, outpatient, post-op surgical, tendon transfer, repair. And then later in my career, I've opened up a community disability-based gym where our goal is to bridge the gap from therapy to fitness and also help apply what does everyone with a neurological injury or disease need to do to maximize not only their health and wellness, but target neuroplasticity to better themselves, to live better, to maximize what they can do, and to help connect people with resources in the community. And so my gym's called Back to Independence Rehab, and since opening, I've learned a lot more about Parkinson's disease and had special certification and training, and I've been very excited to bring in a new demographic to my wheelhouse, but our community gym, and to be able to best provide services for them following what research and best practices are and how to help integrate that into everyday lives instead of just outside of the traditional rehab walls.
I absolutely love your mission. And when I was preparing for this episode, I kind of went back to like my first memory of meeting you. And it was, and I'm sure you remember, it was at the Parkinson's Association of the Carolinas. And then we wound up staying afterwards and talking into the parking lot forever. And my husband was like, just kind of hanging out, like, are you two going to finish it up? It was really funny. And I think, we just became really fast friends. And I was thinking about like, why was that? And, not only were we therapists, we were therapists in the neuro rehab space. We were also business owners, and we were women trying to balance it all and kind of feeling like not a lot of our non-therapist, non-business owner friends got it.
Yes.
It's like, so we were able to kind of commiserate together on the whole aspect of trying to balance home, work, client life, our romantic relationships. Like it is not as easy. People think, oh, you're a business owner. You got it. you must be rolling in bank. You must have so much time. Like, no,
Oh, that's funny.
it's a hustle, right?
It's a hustle. It's a labor of love.
Yeah.
Um, and I think you're right. We did bond over a passion and I think also a shared struggle that we know how to help people. We know how to guide them, but how do we connect what we want to share and teach with the community and help people in the community utilize us, or how do we find a common ground to put that into everyday life? Because traditional therapy only goes so far. Therapy is not meant to be forever in your lives. It's
Thank you
how to
for
gain
saying that.
tools, how to maximize what you can do, and then, continue on and practice that. And one of the big goals with our gym, and even like personally, I know how to work out. I know how to exercise. I've been a lifelong athlete and in sports and gone to school to learn about, the body. I cannot work out by myself. COVID was very hard. I had weights, I had the know-how. I need a community to work out, and I find that's very common with different community members. So I'm hopeful that by providing a space with common community members that have similar neurological concerns, diseases, that they feel like it's a safe space and also a great place of resources to, help get that knowledge and education and integrate it into everyday life where traditional rehab is not meant to be.
Yeah. And I appreciate the fact that you said therapy is not meant to be forever. And I really, we did bond over that because so I've never done the maintenance side, which is what which is what you do. And by the way, you've seen and done it all.
Yeah.
Like, except for pediatrics, I don't think you did pediatrics. You probably had to do a
Not
little.
directly, but I do have some teens that work out with us in the gym, and I do some pool therapy with all ages. So kind of when things are outside the traditional world, that's where we come in. So we'll do some pool therapy. We'll get some kids in that don't have that opportunity in the community, or also as some kids age out of the traditional pediatric world, they want to be able to do strength training and
Yeah.
conditioning like their friends are doing for sports who might be more able-bodied, and we're able to adapt and bridge that gap so that we can maximize and push them further than maybe what some traditional therapy can do in a different pediatric setting.
Yeah. And I think I told you the last time we saw each other, was like, wow, your social media, you went from an empty gym to a completely full gym. Every time somebody does a pan of what's going on, you are so busy and that's so exciting. I'm so happy for you.
Thank you. Yeah, it's been very exciting.
Yeah. And so, oh, excuse me, while I shake the world and turn my page. Sorry. Um, So you talked to us about your journey and all the different settings that you worked in and what brought you to BTI, and you kind of touched on how you got into Parkinson's. Uh, Now, you have a specialty training. Can you tell us about PWR?
Sure. So PWR stands for Parkinson's Wellness Recovery. So you can call it Power Moves. And so when I opened my gym, one of my good friends who's a physical therapist said, Darcy, you need to have Parkinson's in your gym. You're the perfect place for this. And so we kind of had a discussion, how can I best serve them? How can I get the appropriate training? And as an OT or a PT, two of the largest that I'm aware of Parkinson's therapy approaches are LSVT and PWR Power Moves. And coincidentally, they're both created by the same PhD PT neuroscientist, Becky Farley.
I did not know
And
that.
yeah, so her original foundation and research created LSVT for big movements, amplitude, speed training, how we can give the right exercise training and really stop the progression of Parkinson's. And so that protocol is very kind of rigid. Um, you start and lead it through a certain pathway forward. And since I'm not in the traditional therapy world, I was looking at different options more from a group training setting, and that's where Power Moves came in. You can take that certification not only as a clinician and a healthcare professional, but you can always also get a instructor, like a fitness professional can take the instructor level coursework for Power Moves. So they're really trying to find ways to get the information out there, not only for rehab professionals, but for fitness professionals. So that's what I love about it, and how I was able to take the power moves, integrate it into an exercise approach, because that was the goal of it. You can apply it to an individual, to a group. They talk about what the research says with Parkinson's. And I think it's amazing. When I went to OT school over 20 years ago, it was treat the symptoms. What do you do with tremors? How do you compensate with the Parkinson's symptoms that change your lifestyle and how you move? And since Becky Farley started doing her exercise approach, the research behind how to exercise, how to drive the intensity, how to focus on big movements, and address the movements to how you function during your day is amazing. And so that's basically what the exercise is it keeps you moving, trying to get your intensity up, and addresses the big movements you need to do throughout your day. And if you keep practicing those, you'll be able to maintain them. And it's done in sitting and standing, on the floor, in quadruped, or on like crawling position, or on your stomach or on your back. And by moving in all those directions, that's how we develop as human beings. We're on the floor as babies, we roll, we sit before we crawl, and then we get up on our feet. We strength train in those positions, and then you see that carryover in how are you getting in and out of the bed? How are you scooting up and down? How are you rolling to get the covers pulled over you? How are you pulling your foot up and into the car and stepping out, or maybe the restaurant booth? So not only is it good for health and wellness and strength training and cardiovascular training, but the carryover is how do you move during your daily life, and that's how we practice. I like to kind of apply, okay, we're rolling in the bed, we're pulling the covers over. This is why we're rocking and we're rolling and we're pushing through our feet, so that they know that there's that application to everyday life. And if you practice it, then it's easier to just do it without having to think about it as much. And you've got that intentional overflow into how you move. So I integrate the power moves into our biweekly exercise classes. And there's also opportunities virtually, not with me, but if people aren't in a location that has those offerings, there are a lot of great places that have a variety of ways for you to access it if it isn't local in your area.
I love the power moves. I was first introduced to them through another person, and I found how much I loved the way that it focuses on the intent of movement. I'm Speak Out certified, and that's their main cue, is to speak with intent. But I found that if it works for speech, which is movement, even though a lot of people don't classify it as movement, speech is movement. And so when you move with intent, whether it's speech, whether it's rolling, whether it's handwriting, whether it's walking, when you move with intent, it switches the neural pathway for the messages to go down. And so I was completely enamored with the power moves, and I love that you offer it. It's so functional because you're working on movement for rolling, movement for getting up off the floor. So many people are afraid of falling, and it's like, well, you don't have to be afraid of falling if you know how to get back up.
Yes, and I'm glad you brought that up, because Care Partner shared an awesome story with me. So our goal is every week in class, we're getting on and off the floor, because research has shown if you don't have a plan to get on off in the floor, if it's scary, you're more likely to have anxiety and actually be a fall risk.
Right.
And so our goal is to safely get people on and off the floor. Then we practice it weekly. Then they have a plan. It's not so scary. And it's a great strengthening tool to be on the ground using your body weight for resistance training and movement. So sorry, back to my client's spouse, she said, you know what, we had a fall the other day. And in the past, we would call the fire department to help get him off the floor because we didn't have a plan. And she said, he told me exactly how to assist him and what he was going to do. And together they got off the floor with no problems. And so that's exactly why we do it. It made me so happy that, like, mission accomplished. They had a plan. It was successful. And I mean, just think about the embarrassment too if you fall on the floor. Mm-hmm. They were able to avoid that, but I think the confidence that they both had in each other was just awesome. And the same client, he's a diabetic, and so he wears some kind of patch on his arm. And the wife was saying usually she has to, like, try to find some muscle in the back of, like, his tricep area, and she noticed that his arms were getting much bigger. And so it was good for them to share that story with us, just to know that, like, she notices the change. Not only can he safely get off the floor, but he's getting stronger, he's feeling more confident. And I know their big goal also is to have some travel plans and be able to walk through the airport or on their destination. So I'm hopeful that they'll meet those goals as well.
I'm sure they will with your guidance. And I think when we talk about our shared passion, I think that we need to highlight that a win for our clients is so highly celebrated. It's a win. It's not just a win for us. It's a win for our clients. It's a win for our profession. It is why we do what we do. It's why we have created what we created, is to be able to provide our community members with these tools, with the strategies to be able to improve the quality of life. Because at the end of the day, that is really truly what it comes down to. How many people have come to you and said, it's not about quantity, it's about quality?
Yeah.
I mean, I hear that all the time when I'm working with people who have severe swallowing disorders and they don't want a feeding tube. And they say, it's about quality, not quantity. And if I can't eat, I don't want to be here. You know, falling is an embarrassment. I think the top two fears in the elderly population are falling and dementia. And so
we're talking like about my exercise for Parkinson's group. And as much as like the exercise part's important, I think one of the other not as obvious things is the community that it provides.
Yep.
People know they're not alone in their Parkinsonisms and symptoms or needs. And so it's an instant resource group. Hey, which physician do you go to? Or what meds are you on? You know, they can share resources, but also know that they're not alone in their tremors or their struggles with sleeping, or, you know, or sometimes that's where conversation will come up. So we are almost indirect peer support, because someone will start a little dialogue, and before or after class, you know, I'll say, if anyone's willing to share their story, someone asked about X, Y, and Z, or we had a big last month, we talked a lot about nutrition. I had been at a Parkinson's retreat for a week long, and one of the speakers was a PhD researching what nutrition needs for Parkinson's. And I brought her resources home with me, made some photocopies, and each week we went over, okay, instead of all the info at once, we would talk about one sheet. This week we're going to talk about eat your nuts and berries, your darker the berries, the better, and talked about just like one simple swap for what they can do to work towards better nutrition. And then each week we kind of checked in with everybody. We saw what was working for people, what wasn't. And so it was good discussion, it was good education, but it was good peer support. You know, talking about what works for them, what doesn't, what they've been told from other physicians or therapists. So it was a great shared resource opportunity as well.
absolutely.
And people feel safer once they get to know people a little bit better. And I think, you know, we talked about the anxiety, the fear of falling, but I think just anxiety with Parkinson's creates more Parkinson's symptoms.
Yes.
You know, it might be in their movement, it might be in their speech. It definitely affects their mental health, and it causes a lot of other things. And so if you can address, you know, decrease some anxiety, have a place of community, it doesn't have to be your best friends, but to know that you've got some shared similarities with a different group of people that can help decrease that anxiety and therefore make you feel better, but also maximize your efforts with what you're doing, mind, body, and spirit.
Yeah, we go back to the fear of falling and the fear of dementia. And we know research has showed us that reducing social isolation is one of the biggest improvements of our of our cognitive abilities, along with nutrition, along with exercise, along with doing new things. And Darcy, you're hitting them all in your Power Moves class. So there's 2 points in this whole conversation. Is there anything, you went to that long retreat, and I was very, I want to say envious of the fact that you got to go. Now, this is something that I have wanted to sign up to be able to do, but they do not allow speech language pathologists. You have to be a PT, an OT, or an exercise professional. So I'm
Oh, I
trying
feel
to,
like they're so missing out with
I
that.
know because it ties in so well with Speak Out, but I will be
Yeah.
trying to figure that out later. I've not reached out to them yet, but I think I'm going to because
I think you should. I'll put in a
I
good
love it.
word and connect you.
Talk, share with me in the audience about that week-long PWR retreat that you went to. They do it every year, right?
Yeah, I think this might have been the 13th retreat that they've had. They used to be at a different venue in the last few years that are newer one. So it was in Arizona. It's usually every spring, but next year is the World's Parkinson's Congress at the same time. So I don't know what they're doing time-wise for next year, but it is just an amazing opportunity because we don't just need to exercise once a week. We need to get 150 minutes of moderate to vigorous intensity a week. So if that's not something you're used to, just to try to chip away and to get there can take a lot of effort. And so like my group is a week or two or once or twice a week. That's not going to get your whole 150 minutes. And so I think this is a great opportunity to kind of really get immersed into what could I do? What can I do? And if you're doing it every day in a row and you have a group of people that are doing it, kind of reduces your excuses because other people are doing it and they all have Parkinson's.
Right. There's no reason why you can't do it.
Yeah. And so they have an hour of pole walking, which is similar to, uh, we use these specific poles that are designed to help increase your intensity, help increase swinging your arms, to get you moving bigger. And so we do pole walking every morning for an hour and do different drills and exercises with them. This year, their theme was, I forget the specific words, but it was like music and singing and drumming. And so we had some awesome people that came and brought singing to our activities, working on tempo and beat. And for anyone who's not aware, there's amazing evidence that how you can use like a metronome or certain music with beats per movement to help you decrease freezing episodes, to help work on your gait stride, your movement, and just as neuroplasticity, working on your timing, whether it's dancing or drumming. And one awesome presentation they had, sorry, I'm getting a little sidetracked.
No.
They had someone speaking about singing and they have started collecting data. And if you sing, I think it was like for an hour a day, just with effort, lots of effort and singing, it showed their physical symptoms were reduced. It was amazing. The same results I get from exercising and big movements and on and off the floor. And I see people after our exercise class, they've got better facial expression. Their voice is louder. They're moving better. I see them thinking and processing quicker. And so they were able to demonstrate a woman. They had a video of her pre-singing with lots of tremors, slower movements, poor posture, leaning to the side. After an hour of singing, she was taller, she was straighter, she moved quicker, she didn't have as many tremors. So if anyone's musically inclined or needs something new to try, lots of effort. Singing was awesome. So I think not only the intensive exercise throughout the week was beneficial, but the knowledge of all the different things that you can do, whether it's singing or addressing your nutrition, learning about the research with exercise and how to best do it. So once you leave the retreat and don't have access to Parkinson-specific movement training, understanding what you need to do in your own time was really awesome.
Can I just take a minute and just I feel the need to continuously point this out. So basically what you're saying is singing, using your voice is connected to improved physical outcomes? Is that?
Yes.
Oh, can we say that again? Singing
Yeah.
and using your voice helps physical outcomes.
Yeah, just think if you can do it all together, then you're hitting
Bingo.
everything possible.
There's a reason why I call it beyond the visible because yeah, most people, when they think about Parkinson's, they think about the tremor, the stoop posture, the shuffling gait. But just as well as I do, there is so much more to Parkinson's than those three things.
Yes.
Speech being one of them, sleep quality being one of them, the anxiety being one of them, cognitive issues, small handwriting, mental health. Those are all things. And so working on speech helps movement. We're going to get back to
Yeah.
that here in a little bit because I want you to continue about the Power Moves retreat because it sounds just absolutely amazing. And I'm hoping that at some point, maybe we're going to have to do a road trip.
Oh, it's a flight. It's really far.
Okay,
Or we
fine.
just need to find a way to help other people help us create something on the East Coast. So
Yeah,
most of the
amazing.
participants there were from the West Coast, but we had someone from England. We did have people from the Carolinas, from up the Northeast, from Florida, because somehow they stumbled upon it, found out about it. And I think there is a need and interest to have more opportunities than just one location across the country. But kind of how the week ran is you woke up in the morning, you did pole walking, you took a break for breakfast and some rest, and then you would do 2 hours of exercise. So you had either a power moves class, and then you would take like a 15 minutes break, and then you would go to a circuit training class. And so that was your 3 hours of movement every day. Your body's warmed up, it's primed, your circulation's going. Then we would take like a lunch break, or then we would do some education opportunities. And that's where they would have different speakers every day. One day we did Tai Chi, so sometimes it might have been movement, just a different type of movement, or we had yoga. So it gave people a great sprinkling of not only physical movement opportunities, but education. We did like a drum circle and talked about like rhythm and singing and movement and how not only can the singing be beneficial, but practicing those movements for coordination, for neuroplasticity, for movement, but also for joy. So it wasn't like all of these are scientifically proven to be great for you. They are, but it's also like find joy in your life. And I think the overall message was a lot of these are just lifestyle changes. You know, you can eat better, you can exercise better, you can enjoy music, singing, you can find a group of people that all have Parkinson's. And then there was talk about like just finding hope, and they were calling it hopamine. You know, with Parkinson's, there's a
Yeah.
lack of dopamine being utilized. And so when you can find ways to boost your dopamine, you know, make some great lifestyle adjustments, then you can help boost your dopamine. And so the love in the room after this week, you know, everybody's
Yeah.
getting up early to exercise, and I was in charge of the strength station at the circuit room. You know, I'm throwing heavy weights at them. Like a lot of people, I'm sure, thought there was no way they'd be carrying a 20, 30-pound med ball full of water that's sloshing side to
Right.
side.
Yeah.
But I was right there with them. I spotted them. I made sure they stayed safe. You know, they were in control, and I said, "This is too much. We're going to drop the weight." But you know what? Let's try it, because if you don't try it, you don't know. And I think the most telling thing that I noticed, my phone never rings this much, sorry.
It's okay. It's life. It's fine.
Yeah.
People can get over it. That's what I'm going to say.
So this retreat was at a hotel, and we were in their like ballrooms for our educational opportunities and our training sessions, and we walked on the golf course and walked around the building for our hiking. And so the staff that saw everyone that came from Sunday and left Saturday, this was maybe midweek. They were saying, "Hey," I was at the coffee and the tea station on one of our breaks, and they said, "Are you a therapist?" And I said, "Yes, I am." And they're like, "People are getting better." This is just
Yeah.
in a few days. So
Right.
this is the lay person just watching the hotel community members. They saw them a few days before on their earlier shifts in the week, and they noticed they were getting better. And they're not trained to look at posture and movement.
Right.
So for just people, and they're like, we're all talking like people are getting better with what you guys are doing.
I
That was
have
just
bumps on my arms right
awesome.
now. Yeah. I mean, and that
Yeah.
just goes to show you how fast that brain change takes place when you are dedicated to it.
Yeah. And I have to say, they were putting in the time. Like this was 3 hours of the right intensity, the right ways to move, but in several days, people were moving better. And this was an awesome way, not only for them to kickstart bigger habits, but also to keep it going. Because it's hard to stay consistent for long times.
It is. And
Life happens.
Yeah. Yeah, sickness happens. And it's really hard to get started. So I love that shared experience of like getting your engine going, cleaning out the cobwebs. You do it all together, and then you've got the momentum to keep going. But yeah, it is hard to keep going, especially if you're trying to do it on your own, which is what makes your exercise group classes so important. So let's do a shameless plug.
Okay.
About your exercise classes that are PWR, Power Moves. Tell us the dates and the times and how they can get signed up for it.
Sure. So our exercise class is Monday and Wednesdays from 12 to 1. We do require an assessment first, and really what the assessment is getting to know the person, helping them feel safe, and giving them time one-on-one to go through the exercise training so that they know what to expect, decreasing that anxiety, making it not as scary, and also giving them an opportunity to move at their own pace or to review how do you get on and off the floor safely so it's not so scary. And to find the bathroom and to know what to expect, see familiar faces.
Yeah.
So we go through that initial assessment. I get a good idea of what their medical background is, what their Parkinson's symptoms are, what their current exercise habits are, and then to review. And so I go through a summarized exercise class, and I say, these are the moves. And at the end, I said, you just did a Power Moves class with me. This is what to expect. You did fabulous. This is what to expect. We will modify to your needs. I've got amazing staff and students and volunteers that lets me have people sprinkled around the room to spot people while they're standing, so that if they're fearful of falling or a little unbalanced, that we can still meet them where they're at and keep them safe. Or if I have a caregiver that's with us and is their driver, I'll say, hey, can you spot them during the standing portion or help facilitate the on and off the floor? But if I train that caregiver, now they can do it at home.
Bingo.
Maybe if they're out at the restaurant or there's a stumble and a fall, they have a plan. And then they're not both ending up on a pile on the floor because they're trying to pull each other up. And so my big goal is to empower the person with Parkinson's to get on and off the floor, but to know how and not look for someone else to really need to help them, but to say, hey, I need to go crawl over to that chair, or this is what I need from you, not reaching up and trying to have someone else pull them up. To show them that they can do it and give them, some ownership of their own abilities and confidence.
Yeah. My grandfather used to, mind you, he was like 6'3". He was very proud of the fact that he still weighed like 190 pounds. It was the same that he weighed in high school. But my grandmother was less than 5 feet and weighed a lot more. She was not an exercise enthusiast. And he would look at her and say, come pick me up. And she would say, I can't pick you up. And that's how my dad actually hurt his back, was picking my grandpa up in the bathroom.
Wow.
Yeah. It creates more independence. And independence just feels fabulous.
Yeah. And one thing I wanted to add to the end of the retreat conversation is at the end of the week, people had opportunities to share their story or their review of the week. They didn't have to, but a lot of people wanted to because they were so proud of themselves and proud of each other and the friendships that they had made, but also the progress and the education. And one gentleman that was very memorable to me, he said, since he was diagnosed with Parkinson's, the doctor said, do you exercise? He said, no. His friends who knew enough about Parkinson's and knew you should exercise said, are you exercising? He said, nope, not going to do it. His family was saying, you need to exercise, Dad. This is what they say you need to do. And he said, nope, not going to do it. I don't remember his story for what helped him get to the retreat, but he was someone, of course, my station was the first one to get people on the floor, I think, or one of the first few. And so we would have chairs to help get them up or down. And he was really sore, really achy, a lot of flexibility challenges in the beginning of the week. And by the end of the week, he wasn't hurting as much. He wasn't as stiff. he was stronger, he was more flexible, and he was so much more confident. And he shared at the end of the week his story of, nope, exercise isn't for me, to where he did a whole week of 3 hours of exercise a day. And he was moving better, he felt better, and he said he's going to go home and he's going to keep exercising.
That's amazing. That's
Yeah, that
amazing.
was an awesome story.
A lot of people don't understand that increased pain is one of the results from Parkinson's. And if people do know that, they think that it is from the rigidity. But I just want to kind of connect a dot here. Parkinson's is the death of dopamine cells, and dopamine is the feel good neurotransmitter. And so when you don't have enough dopamine, you hurt all the time. And it's hard to be
Yeah,
happy. And it's really hard to move when you hurt all the
yeah,
time. Even people without Parkinson's, like my mom, she won't exercise because her back hurts. Why does her back hurt? Her back hurts because she doesn't exercise.
got to start somewhere, work with what you have, listen to your body. Practice
Right.
makes perfect. There's a reason we have those sayings.
Exactly. I don't like the saying no pain, no gain, though. I don't like that one at all.
Yeah, I think
Uh,
pain's there to respect and understand,
for
and there's a
sure.
right and a way to push through and work through it.
Yeah. And I think the lesson here is for anybody listening with Parkinson's, without Parkinson's, is movement matters.
Yes.
Movement makes you feel better. Strength matters. I follow a neurologist on Instagram, and I don't take a habit out of getting medical advice off of social media. But here we are we're not giving medical advice. We are sharing stories. But anyway, here we are doing that. But this neurologist says, you can choose your hard. You can choose to get up every day in your 20s and 30s and exercise and be strong and eat right, or you can be in a wheelchair later on. Choose your hard. And I think about that. And that was one of my main motivators for getting myself back into shape was I don't have kids to take care of me. And
Hmm.
so when Jamie and I age, we are going to have to age gracefully if we want to stay independent and we don't want to be in a home.
Yeah.
It's scary though. I mean, it's really scary, but movement matters no matter
Well, and
what
I
you're.
think, sorry, the important part of talking about pain. So in this last year, had some chronic back pain and had to have back surgery, which
Yeah.
was crazy to me. I'm a fitness professional. I teach other people how to exercise and move. Sometimes life just happens and you can't control it. Because I even asked my orthopedic surgeon, like, why is this happening? I've been doing all the right things,
Yeah.
managing my weight, staying strong. And he said, well, you're aging and sometimes that just happens. But through the pain, I actually felt better when I exercised. I felt
Yeah.
better when I moved. It helped me bounce back after surgery more. And it helped my mental health and it helped me sleep better because that
Mhm.
was a huge struggle with my chronic back pain with sleep. And I had a hard time coping. I
Yeah.
hurt, so I couldn't sleep. I couldn't sleep, so I couldn't cope. So not only could my physical part was holding me back, but it was a big struggle just like mentally and with sleep deprivation, to find a way. How can I sleep better? How can I reduce the pain? How can I work through it? Uh, and so I think pain does scare a lot of people off, but I think that's also what they need to do to get through to the other side is
Yeah.
not be as scared of the movement and find a healthcare or fitness professional to help meet them where they're at, customize that movement plan, and guide them through it.
Yeah, let's talk about customization of the
Okay.
fitness plan. We've heard it at several Parkinson's conferences. When you've seen one person with Parkinson's, you've seen one person with Parkinson's.
Yes.
How important is it, in your professional opinion, with all of your experience and all of your knowledge, how important is it for our clients, our community members with these diseases and impairments, how important is it for them to find someone who specializes and why?
Yeah, no, I think that's really key, and I think a missing component that not everyone always gets delivered. I think we have amazing physicians and movement specialists that say exercise, but I don't think they always know the different aspects of exercise and who's doing what in the community. I think someone that takes the time to understand Parkinson's, and also look at the evidence and the research that says this is how you need to exercise, the person with just the knowledge to guide you is going to help you quicker do the right things, do the right movement to come out better. So specifically with Parkinson's, you want someone that's going to safely guide you to increase your intensity. Intensity can be measured with breathing heavier. So it's not looking at a weight. And also with Parkinson's, it's very common to have heart rate irregularity. So a heart rate monitor might not be measuring appropriately your intensity. So even if you have a watch or a chest monitor, your numbers might not be as appropriate. And that's unfortunately just comes with the territory of Parkinson's. But without any fancy equipment, you can exercise and just check in with yourself. Am I speaking really easy? Am I catching my breath while I'm talking to my friend and we're speed walking and swinging our arms with our poles? And so when I run my class, we do check-ins and I say, okay, are we moving big enough, or are we adding resistance, or are we adding speed? And is that increasing our intensity? And a lot of times I'll just do a quick review. Why do we want intensity? That boosts our dopamine, and we can self-reflect by breathiness. Are we needing to take a big gasp of air? Can we say a sentence, but we want it to be a little bit uncomfortable by working hard enough? So just walking casually through the neighborhood isn't going to be enough.
Yeah.
You really need to be taking large steps. You need to be going up the hills, walking up your stairs to increase the resistance and load on your body is going to increase your intensity. So you need someone that's comfortable guiding you. I don't care if you're 50 or if you're 85, you need someone that understands Parkinson's to say, I need to increase the intensity. I'm not going to give you a little can of soup to do a home therapy session. You know, how can we be safe but push the resistance more? Can we use your body weight? Can we, lean over on the chair or the table to get some more load on your shoulders? Can we go closer to the ground? So by pushing that intensity safely, you're going to be driving that dopamine and maximizing your abilities. So you need someone to safely push you hard enough, but keep you safe so you're not a fall risk and not going to injure yourself. And you need someone to understand a little bit of your medical background. So as we age, we've got a long history on our body. Do we have knee or hip issues or past shoulder issues? So you need to understand kind of the ins and the outs to keep someone safe, because as we said, pain limits people from wanting to move. So if something hurts or something hurt in the past, they're going to be more resistant to doing it. But if you have someone that understands your body, understands your past medical history, they can get you on, okay, this is how you can modify and customize this movement plan so that it doesn't hurt, it doesn't exacerbate old injuries, but we can continue on that trajectory of moving big, maybe moving faster, driving that intensity. And that might be where you use traditional therapy. Have a therapist give you that good guidance and knowledge, and then you can go to a gym instructor and say, this is what I need to match for me to customize a workout plan. Because as we said, therapy doesn't last forever. And so knowing how to move without pain to address the intensity, and then also moving big. So with Parkinson's, the common symptoms are moving smaller handwriting, posture coming forward. So we need to address big movements so that we don't move small. We practice moving big. And also we practice using those postural muscles to help improve our own body awareness of where we are in space. In Parkinson's, it's very common to not know where our body is in space. So when people are told, stand up taller, with Parkinson's, they really feel they're trying to stand up as much as they can. And when our body and our muscles get really tight and they pull us into a tighter posture and shortened muscles, that becomes our body's new normal. And so when they think, oh, I'm standing up straight, but why do people keep giving me a hard time about it? Their body's telling them that's their normal and that's up straight. So that might be where they need to go to therapy. They need to go to a healthcare professional to help them learn where their proper posture and body awareness is, lengthen those tight muscles, use a mirror for visual feedback, be able to have a better self-reflection or technique to check in with their body to improve that posture. So when someone says, hey, you need to stand up taller, they're able to, because then they understand where their body isn't the appropriate place, but maybe they're really tight because they've been there for years, cumulatively. So they need someone to help lengthen them so that they can move bigger.
Yeah.
And so then practicing those big movements to become more of a habit is huge. So overall customizing safety, intensity, and big movements is huge. And to find a healthcare professional or fitness professional who has special Parkinson's training, so LSVT and power moves for OTPT, speech can also do LSVT or your special certifications. I think it's important for people speak to Parkinson's community members to know how to find those specialized clinicians, because unfortunately it's really common you see physical therapy facilities in your area, driving down the street, but they might be appropriate for the mainstream of the population and might not be up to date with the best practices for someone with Parkinson's. And so I really educate my community members when they are going to therapy. Does their therapist specialize in Parkinson's? Do they have any special training? What's their experience? Because if I hadn't taken power moves, my training would not be near as intense, not as appropriate for someone with Parkinson's, because the research changes. So you need to be able to follow up with how to best serve your client demographic. And with Parkinson's, we have other life changes. Back pain, shoulder pain, orthopedic injuries. If you can find someone who understands the orthopedic approach and the Parkinson's approach to blend it,
Unicorn.
or go to one clinician, and it is a unicorn. There are those out there, but I think just to empower a community member with Parkinson's to know to ask the right questions. Not all therapists are created equal. We all have different passions, different experiences. So just to say, hey, this is my needs. What's your experience with it? Are you the right fit, or do you recommend someone else? And so with a lot of the Parkinson's specialized training, you can go to their websites and you can find a healthcare professional in your zip code. So then you can find that person and not have to call all around.
Yeah, LSVT, I think it's LSVT, is it .org or .com? I can't remember.
Oh.
Go do a Google search, LSVT, power moves, and speak out. So for speech therapists, we do LSVT loud or speak out. And then for PT and OT, it's LSVT big. So before we talk about, I want to continue the conversation about specialization. For any clinicians that might be listening. But first, I want to take the opportunity to talk about LSVT, speak out, and the whole idea of moving big and why that is so important. Because I don't know that all the clients and the family members understand why that moving big is so important. I'm going to approach it from the speak out point of view, which is the use of intent. When somebody tells you to move big, you're intentionally moving bigger, and therefore that message, instead of going midbrain down, which is where automatic movements are. So automatic movements, walking, talking, handwriting, breathing, those are all automatic movements. And so when we go to do those automatic movements, if we're not doing it intentionally, they come out smaller in people with Parkinson's. So when, Darcy, you tell somebody to move their arms big, if they're not moving intentionally, big is going to be big versus big. So that's so important. And then addressing to the perception. I can't tell you how many caregivers have been aggravated. I keep telling them to stand up straight. I keep telling them to, speak with intent. And they say they are. And I like to think about it this way. I mean, I love the way you described it too. For speech, at least, these people with Parkinson's have spoken with the same amount of effort for their whole entire lives. They've moved with the same amount of effort for their whole entire lives. And now that they have this disease, that amount doesn't equate to the amount it used to. Mm-hmm. And so it takes an adjustment period of realizing and recognizing, which is why the mirror is so valuable. So Darcy uses a mirror. I use a sound level meter to measure volume. It's like, okay, how much effort do you think you're using right now to speak to me? Because right now the sound level meter measures 62 and I need you at 75, right? And then
Yeah.
it's kind of like, oh, wow. And I can't tell you how many times I've whipped that darn thing out and said, how much are you being intentional? And they'll say, I think so. Like, look at the volume. You're not. Um,
Yeah. And
and
so
it's,
there's certain tools we talked about, like specialization and having the
yeah,
right person guide you. So there's tools that we can use, but also we can teach them to use to carry over. So whether it's a
yes.
voice meter or I'm using a mirror. And sometimes I mentioned like people aren't as aware of where their body is in space. That can also limit their big movements. They might think they're
Mhm.
moving bigger. So sometimes I'll have them reach for targets in our circuits. So they have to move bigger. They
Yes.
have a target so that visually they can connect to how far they have to reach. Or by putting something in your hands, like sometimes we'll use pool noodles. They have to hit the floor as hard as they can. Or there's certain targets or directions that we'll give them so they have a visual target on where to move to help them move with intent. So there's great tools that we can use to physically move, to verbally, vocally move. And also it's amazing when people lean and reach, sometimes they don't turn their head or use their eyes. So by having someone coach you to say, okay, look at your hand. You're
Yeah.
rolling, but now look at where your hand's going, or look at the ceiling as you reach and are twisting your body. They move a whole foot longer. They move
Yeah.
bigger. So being intentional with where their direction is going, um, they can really drive bigger movement. And so sometimes it's just these simple skills, or with power moves, they call them different boosts, using your eyes, using your voice, using some targets that you can help improve what you're already doing and making it better.
Yeah. So let's talk about from a clinician standpoint, because sadly, with all these specialty certifications, reinsurance does not reimburse us anymore for them.
Yeah.
So when family members and clients are wondering why doesn't everybody have these specialty certifications? One, they're a lot of money.
Yes.
Two,
And
they don't,
time.
and yeah, they're a lot of time, and time
It's
is
a
money.
3-day weekend that we're taking out of our free time with our friends and family and rest and relaxation to better ourselves as, our professional skill set and knowledge. But it's tough
Yeah. And I think,
financially,
yeah,
time-wise, and as you and I were very passionate to serve our community members. Like our why is having those success stories, but it
right.
also comes at time away from our family, time or money out of our pocket to do those things. So it's hard for a lot of people to do all the things. And usually therapists want to do all the things, and you have to find how to draw those boundaries or figure out, and is always a struggle, how to do all the things, pace yourself out, how to afford it, what's your timeline look like.
Well, yeah,
Yeah.
and it's not always rewarded in the bigger corporate systems. And
Yeah.
that's kind of where I was going with that. It doesn't equate to a higher reimbursement. So the hospital administrator really doesn't care if you have these or not. And I'm not trying to talk smack about anybody. It's just it's the reality of the situation. So when you have therapists that take their time and spend their money because they just love the mission, right? It's their mission. So, Darcy, how much did you learn about Parkinson's and even neuro in general? How much did you have in school, in your degree program?
Oh, granted, it's 20 years ago.
Right.
It's been a long time.
That.
And in therapy school, you have to learn how to address everybody from newborns
Yep.
till aging.
Yep. Same
So
with
to address
speech.
someone from 0 to 100 and something, orthopedically, neurological disease, injury, um, all the different aspects of life that affects us and how we move. And so as an occupational therapist, I'm looking at function and, how could we be independent, but also what's most important to the person and how can we maximize what someone can do for themselves to find the best joy in their life and quality of life, whether that's physically, mentally, spiritually, participate in their important life skills. There's a lot to learn. There's a lot on the foundation of the body, the anatomy, the physiology, then breaking down how to address those, and then learning about all the potential diseases and injury risk factors and how to treat it clinically. So there's, long story short, there's a lot that we do in school. And so the little part that I learned about Parkinson's, and 20 years ago, so much has come
So
from what
much
to
has
do.
changed. Yeah.
So
Yeah.
I really don't feel, looking back and not working with Parkinson's in my early years, I didn't come away with a lot. But this last decade alone of the research that's come out, how to address it, has really made a bigger difference. So I think more recent new grads are coming out with a better idea of what to do with Parkinson's, but it's still just scratching the surface.
Yeah. And
They've heard of some of the certifications, if they've clinically seen it with their student rotations and they have an idea from their mentors, but it's still just surface level. And my goal, we have a lot of awesome students, and my goal is to not have them shy away from pushing people intensely enough. No matter what their diagnosis is, I don't want people underdosed.
Yeah.
If no one pushes them, who's going to if we're not doing it? And so our big goal is there's a way to do this safely, and I want my students to find that safe way to push people hard enough, but also know this is what the research says. We have to do this to do right by our community members. So that is our goal. And they'll say, well, we're going to do this. And I said, okay, more, harder, faster. Are they breathing heavy enough? Because we can use that to check in on our clients. Are they chit-chatting and having a great time? Well, I love getting to know our clients, but that means they're not working hard enough.
Right.
So I might need to say, okay, we're pausing, we're going hard, we're going to get your heart rate up because we're talking way too easily. And so that by showing not only our students that, but teaching our community members that, we're learning as healthcare professionals how to monitor that intensity. People are understanding how we're trying to get that right dosage, because we want to work smarter, not harder. If you're putting the time in and the effort to better yourself, let's make sure that we're doing it the right way.
Yeah. So take a second and explain dosage for anybody who might not completely understand. When we hear the word dosage, we think about medication, which movement is medicine. But
So if we think of,
yeah. Go ahead. Sorry.
So dosage, we need to exercise 150 minutes a week. So that's like if you can, for 5 days a week, do a 30-minute workout, or 3 days a week, do about an hour workout. That is the right frequency of exercise, but you need to make sure you're doing it at the right dose, that you're doing it intense enough, that you're getting the right resistance training, that you're getting your heart rate up so that you can maximize that dopamine. If you're just taking a leisurely rock around the neighborhood on the flattest part possible, you're not getting your heart rate up, you're not challenging your muscles, so you're not necessarily getting strong enough, and you're not targeting your heart enough for cardiopulmonary benefits. So with dosage, you need to look at what's the time you're putting in, but what's the intensity.
Okay, thank you. Intensity. Yeah. Dosage is intensity. I love that. All right. Can you talk about how occupational therapy and speech therapy complement each other?
Yes. I've learned so much from my speech therapist that I've been able to be on a team with. I'm a huge believer in being a good team player. I think as a whole, when you've got a great OT, PT, and speech therapist together, collaborating, throw a mental health professional in there, a case manager, you'll find that on inpatient rehab. It's hard to find it once you're not in the hospital. We don't want people going to the hospital. When you have a traumatic injury or big disease onset, that's kind of the trajectory. You can get to package up a good care team. But we don't want people to have to go to that extreme to find it. So commonly...
By the way, that's why I love palliative care. So that's another discussion for another time. But palliative care, that really helps with that.
Getting your rehab team formed, yes.
Yes, your rehab team is so important. Anyway.
Yeah, well, and we talked about intensity. More is better. So OT and speech, we're both going to address functional skills, sprinkling in how to address dementia, how to best work on sharpening our thinking skills, our memory, our daily functioning. So my approach is probably going to be more, how do you function? What's most important to you? How can we implement things throughout your day to maximize what you can do, to keep your thinking sharper, to keep your independence maximized? Where with speech, you're going to come from a little bit different approach, that if you want to sprinkle in your specialty, so I'm not speaking for you, but I think as a team, as I said, more is better. PT does amazing gross motor work, fall risk. I'm going to be doing that too, because movement is medicine, but my movement might be more towards moving in bed, grocery shopping,
Tying
how to
shoes.
pick up your grandkids, fine motor, how to tie your shoes, do your clothing fasteners. PT is going to be more the movement, but together we're all better. And I think a lot of people don't get that whole rehab team. And I know you and I are big advocates on, well, where are you going to therapy? Who are you seeing? Oh, that's an awesome PT. Where's your OT? Where's your speech therapist? I think people are getting cut short on what they need to know and do to maximize their skill set and their abilities and their education.
Yeah, I know that one of the things that you and I have commiserated about since day one is how OT and speech are very frequently overlooked. The doctors tend to know what physical therapy is, and I even know this from the standpoint of business mentorship. You know, I once had a PT a consult with a PT business mentor, and he was talking about how I should, focus my clinic on back pain. That I know, and it annoyed the crap out of me, because I was like, I don't care. Like, I don't care about back pain. I want to help people with Parkinson's. Like, that's what my gym is about. And he said, in order to get people through the door and for doctors to recognize who you are, you need to focus on things that they'll refer to for PT, because they know what a physical therapist does. They have no idea what an occupational therapist and a speech therapist does. So I like the way you broke it down to where you do work on movement, but you work on movement for the function, the things that you have to accomplish in everyday life. So I used to get tickled. One of my colleagues, my past colleagues, coworkers, Tasha, would be so annoyed when she would walk into the room and say, "Hey, I'm Tasha, I'm your occupational therapist." And they would look at her and go, "I don't need a job, I'm retired." It's like if she had a quarter for every time she heard that. Just like for me, "Hey, I'm Michelle, I'm your speech therapist. I'm here to look at your swallowing. I don't need to swallow, I just need to walk." I beg to differ, right? Some of my favorite treatments that I have ever done was with an occupational therapist, occupational therapy assistant, working on like post-stroke. Granted, this is a podcast mainly about Parkinson's, but working on post-stroke where the person was having confusion, but also deficits with ADLs, which is bathing, toileting, brushing teeth, hygiene, those kinds of things. And so the occupational therapist was working on being able to bathe. And then I was working on the sequencing. And so Tasha and I'm sure she remembers, is we had this saying, "No poo germs on the face," right? Because when you're doing a bed bath, you don't want to wash down there and then wash your face.
Yeah.
And that was something that we actually worked on. And using humor with one of our mutual clients, actually was more effective than the gentle approach. But as soon as we would say, "Wait a minute, no poo germs on the face." "Oh, right." So, then she would wash her face first. But even working on the sequencing of brushing teeth, because cognitive deficits are real and they may seem really silly to a lot of people who do not understand what happens at the level of the brain when blood flow is disturbed. But I've worked with people who will forget to put the toothpaste on the toothbrush, which is not that big of a deal, but they might be brushing their teeth and then stop and put the toothpaste on and then put the toothbrush up on the sink. Like, they knew the parts, but they couldn't get it together in the order that it normally goes. And so I find that working on speech therapy, speech and language is abstract. And we have to hit a lot of abstract tasks, which people don't always appreciate. They don't always appreciate color sorting. I have different colored cups and different colored owls. And we're going to put the yellow owls in the yellow cup. We're going to put the green owls in the green cup. And it seems so basic and elementary, and it really upsets people. But abstractly, you have to be able to focus long enough to find the word you're looking for.
So I think to highlight the cognitive deficits, you can't see them as easily.
Right.
And we talked about like movement and fall risks earlier. I can have people, I had a 90-year-old doing a plank and push-ups. Physically, he was killing it. But cognitively, he was a fall risk because he couldn't remember the right sequencing to back up to the chair, to reach behind him, and to sit down so that he didn't miss the chair, that he didn't use his rollator for long endurance walking and forget the brakes and fall. So if you don't have that cognitive sequencing, working on that memory, that can be your fall risk. It's not all physical, and sometimes, like you said, the abstract is hard for people to see, but just more importantly, why they need to work on the cognitive, why people need speech therapy referrals to get a good understanding and address those skills so they don't slowly worsen and creep up on them and make them that fall risk or have other things become more complicated and a challenge with their functioning.
Yeah.
And so that's a big thing that speech and OT do. And some PTs are amazing at dual tasking too, but this is way too many skills for one healthcare professional to address alone.
Yes.
And that's why, as a team, we make a powerhouse. Doing the fine motor, the gross motor, the speech, the cognition, and a little bit of overlap as necessary because we need to blend those skills because that's how we function. We don't just walk and do nothing else. We don't just brush our teeth and not think of anything else. You need your cognition. You need your fine motor. You need your gross motor. You need all of everything to coordinate together.
Yeah, I appreciate working with OT because they help me find more functional tasks. And I will say, as a speech therapist, I am not confident with walking with some of these people. You know, I can think of a handful of people that I have right now that I see in home where they do so much better. They're more awake, they're more alert, they attend better with the occupational therapist because the occupational therapist has them up and moving. And I go to see them and they're basically falling asleep in their chair. And it's like, man, I wish I could, but there are insurance regulations that keep us from being able to treat at the same time. But that's, I think, co-treatments, and even I did try treats at one point when it was allowed with PT, OT, and speech. And oh man, what a difference. What a difference it made. And so that's kind of where we get into, why it is beneficial to do a private pay basis like your gym outside of relying on insurance. Because the insurance industry has a lot of regulations, and I understand why, but they impact all the things that we could potentially do that might make more progress than what their rules would allow. And I love the structure of your gym because you are a private pay source, but you don't have to go by the regulations of insurance. So you are free to really do whatever. And it makes a difference. It makes such a big difference.
And like you said, sometimes our hands are tied because of what we can do, because of what insurance will cover, or that there's not too much overlap between different clinicians addressing a certain skill. The skills they want to do. I really want to walk. I don't want to do this as much. Well, you need to walk to carry your laundry and to do all these other things. So some OTs can be awesome with, hey, we're going to walk and we're going to do all the ADLs, and I can justify that. But then there becomes a limit. Maybe you're safe walking at home, and insurance is fine with that. They don't care if you're going to take a hike with your grandkids.
Right.
And that you're at that level. So if I have people that are like, hey, I want to be able to go to this wedding and be on the dance floor and work on my balance skills, if insurance says, well, you're safe enough you've made enough progress, you only have this many visits. Sometimes that's really tough because we want to get people to really meet their goals. What's more important to them? It's not just walking at home, just carrying your laundry basket. It's killing it on the dance floor at your family member's wedding, or being able to take that vacation and that trip.
Yeah. Hiking with
So
your
I think looking
grandkids.
at all your options, and I think having a healthcare professional to also provide a little bit of that education on where they're limited. I think that's the hardest part, that, if we can somehow share that knowledge that we want to do more, but we're limited. Because I have someone that called me yesterday. His father has had like a year and a half long of medical concerns, and therapy saw him for 15 minutes supposedly and said, I can't see you anymore. Go look at Darcy's gym, BTI Rehab. And he's like, why did they give me your brochure? They just like stopped mid-session. And of course, the conversation was through a caregiver and his father. And so there was different telephone trails. And so I really tried hard to manage up for those previous clinicians and say, well, he's been in therapy for a long time. You guys have used a lot of benefits. As a clinician, if we can't show enough quantifiable change within a certain amount of time frame, we are limited with how long we can keep people. We will get denials, and then we can't continue to see people. And so I think that's the worst part of our job,
Yes.
is when we have to say we can't keep seeing you. And I think the most important thing that people need to be told or to hear is that no isn't forever. No is
Correct.
at this time, we're going to take a break.
Yeah.
At this time, this is where we're at. Now it's your turn to do the work. You need to put into practice what you've been taught. You need to exercise. You need to continue the repetitions, because therapists can't just count reps and keep doing the same things. You need to find a community member. You need to find a group to support you. You need to find your own motivation or accountability partner or process to put in the work. And that's where there's groups, there's one-on-one training, there's other opportunities to create those lifestyle habits. Therapy is not a lifestyle. It's let's boost you to the next level. Let's help you feel better. Let's decrease the pain. Let's give you the tools, the knowledge, and then let's let you fly the nest. And then therapy is there once you're ready to go to the next level for more functioning, or if something happens, to help kind of get you back up to where you need to be, or to monitor you throughout the progression. If there's changes, if tremors are stronger, if you're feeling less stable, then go back to therapy. If cognition's changing, then go back to therapy. Get that upgraded training, exercise to circle back. So I think people need to be told that therapy can be cyclic. A lot of people find their way there, but they get to be great advocates. The people that don't know to question the healthcare system or ask the right questions don't find that return visit. To know that, like, we are always evolving, we are always changing, we are all lifelong athletes. We always need movement, performance, upgrades, changes, check-ins. So that's where therapy is, to help pick you up over time. It's not when you get your initial diagnosis and then never.
Right. Yeah.
Maybe it's once a year. Maybe if you're progressing quicker, maybe it's twice a year.
Yeah. For
But
Speak Out.
if you find a great routine, community, exercise program, you can stop the progression of Parkinson's.
I think that's important. I need you to say that again.
You can stop the progression of Parkinson's, but you have to be consistent and put in the work. Research has shown that if you exercise and do the right therapy training, you can maintain where you are, you can improve. There's an awesome gym in California that I love to follow, and she's worked with this one woman. It's like 10 or 17 years, and they have her trying to jump rope, and they show her like years over time. She is jump roping better than she did a decade ago, and she's like killing it. Living with Parkinson's has not slowed her down, and she's better than where she was a decade before. That is our dream for our community members, to give them those tools to maximize what they can do and to be better than where they used to be, and to keep doing it. But we always need to exercise and to move, That's going to help us live longer, and that's going to keep our Parkinson's symptoms at bay and decrease them. But it's an ongoing effort.
It is. It's an ongoing effort. And I love everything that you just said. And I cannot wait to cut that up and make it a short and post it all over social. um, for speak out therapy, we say every 3 to 6 months, you should come in for a refresher. Every 3 to 6 months. And, people might be different. There's a gentleman that I worked with, 3 months after diagnosis, got him started on the program. He has had no decline in speech, minimal decline in swallowing, came back for a refresher, good to go. It was 2 years later. But the reason why the refresher was 2 years later is because he did his home exercise program. He attends regular support group meetings. He does rock steady boxing 2 times a week, and he only takes a break if he has, if he goes on vacation or has had a fall and he really legit can't move. And so that's why it had been 2 years. He did an amazing job putting to use the tools that I gave him. I didn't do the work for him. I said, this is what you're going to do. Now you have to go do it. And he did. And he didn't need a refresher for 2 whole years. That's the goal, right? It's crazy to think about a profession that works themselves out of a job. That's what we do. We try to work ourselves out of a job. And we do it with love and passion. Yeah. I mean, sure, it is very difficult to discharge our clients, our patients. It's very difficult because we get to spend, 45 minutes to an hour with them multiple times a week. Mm-hmm. We get to know these people. We, at least I do. I have people that I consider family. I mean, they're family. And I hate when I have to discharge them because it means I have to go for months, and not hear from them and just hope that, everything is going okay.
And therapy is hard work. It's not easy.
No, it is.
It's addressing something that's really affecting you in your daily life, and to coach someone and get them to a better place. We get attached to them, and we're passionate about guiding them through that period. Yeah. So I love when people tell me their wins. I would rather them email me a win instead of coming back and not doing their carryover of their exercises and have to reset. We are there for that. But like you said, we want to coach people and hopefully have them not need us in that capacity.
Yeah. I just so beautifully said, Darcy. So beautifully said. And I feel like that is a good point to wrap this conversation. Thank you for spending so much time with me this morning. I know that you're a very busy lady and that you have a therapy session coming up that you need to get ready for. Is there anything else that you want to add or talk about?
I think we addressed them all. Thank you so much for having me. I know we're both very passionate about getting our message out that you can stop the progression of Parkinson's. You can maximize your abilities to think and speak and move and swallow. And so hopefully we've laid some groundwork and motivational for people to better themselves or coach and support a loved one or to be a clinician so that they know that there are amazing things that we can help our Parkinson's community members with to stop the progression of Parkinson's, to move better, feel better, and there's a lot that they can do and take on with lifestyle changes, therapy tools, and it's not just a disease that's going to manage them, they can manage it.
People can get a hold of you and contact you. Let's say I have somebody who wants to come attend your gym for whatever reason. How do they get a hold of you?
Sure. So they're welcome to email me. My information's online. If you look up Darcy Pernoud or Back to Independence Rehab, we call ourselves BTI Rehab. To shorten that a little bit, www.btirehab.com or backtoindependencerehab.com. or Darcy at BTI Rehab. And my phone number is also online. So any of those ways you can get a hold of us. You can schedule an assessment. You can come work out with us. We'd gladly help anyone along their recovery journey to maximize their potential.
Absolutely. And for anybody who has not heard of Darcy until now, her gym is a flippin' gem in the middle of Charlotte. And whether you're coming from South Carolina or North Carolina, if you're looking for regular exercise for Parkinson's or brain injury or spinal cord, and you're looking for somebody who truly specializes and actually truly cares about what happens to you, you've got to go to BTI. You've got to go to BTI. That's all I have to say about that.
Thank you, Michelle.
Thank you so much, Darcy. I look forward to, maybe we'll do another episode when you have time, when you're done getting clinicians and having students and people out on medical leave. I am so grateful for Darcy for joining me this morning. She took a few hours out of her day to record this episode, and I feel like people are really going to benefit from it. So if you enjoyed the content of having somebody else other than me up here yammering about different things and different aspects of Parkinson's disease and neurological disorders and healthcare industry and such, please give us a like, subscribe, tell your friends, your family, anybody you know who could benefit from the education that we provide on this podcast. Again, I'd like to thank Darcy. If you would like to get a hold of her, www.backtoindependencerehab.com, and all of her information is listed there. So, thank you for joining me, and until next time, stay curious and keep looking beyond the visible.